It's National Diabetes Awareness Month, and we are talking with experts about managing and diagnosing diabetes. According to the CDC, about 38 million Americans have diabetes. That's 1 in every 10 people, and 1 in every 5 people don't even know they have it. I'm joined now live by Rebecca Harris, a nurse practitioner with Mercy Health. Thanks so much for joining us this afternoon. Let's start by talking about getting a diagnosis. What symptoms or risk factors should people be on the lookout for?
Hi, yeah, so diabetes is obviously fairly prevalent, and so risk factors can include families that have diabetes in one or both parents, or a long history of diabetes in their family. And then risk factors, additional health issues like heart problems, kidney disease can also go hand in hand with diabetes. So those people especially should be getting screened. And symptoms can include things like changes in their weight that are sudden, or even noticing increased thirst and urination. But more often than not, a lot of people with diabetes don't even know that they have it because they don't have symptoms yet until they come in for a normal checkup with their physician.
Now, for someone who is newly diagnosed, treatment and maintenance can be daunting. What tips do you have for people who are new to the routine?
Usually, I just tell them to kind of take things one step at a time. So we'll talk to them about medications. We talk to them about monitoring their blood sugars, and then we try to hook them up with the resources as far as learning some changes that they can make in their dietary habits and routines to help.
Now, for people who have lived with diabetes for years, what should they know about new treatment options?
Treatment for diabetes is evolving all the time. We have insulin pumps, we have great diabetes technology with continuous glucose monitors, and those resources are becoming more widely available for everyone living with diabetes. And so I always encourage them to kind of look at those treatment options as well.
Well, obviously, diet is a really important factor when you have diabetes. What are some diet habits people should stay away from, and how do they build a healthy habit?
Obviously, we encourage them to limit their sweets. We talk to folks a lot about carbohydrates as those break down into glucose into their system. And so I think the biggest thing that I try to encourage folks, especially newer to the diagnosis, is again just try to take it one step at a time, and really to practice good moderation. And I think that that's good tips really for any of us.
And finally, what resources does Mercy Health have? How can you guys help people out?
Well, obviously, as a nurse practitioner, I devote my entire focus to just treating people with diabetes. We also have a great team of registered dietitians that are here and available to talk with people about their dietary planning and nutrition needs.
All right, Rebecca Harris, nurse practitioner with Mercy Health. We thank you so much for joining us this afternoon.
Sure, thank you.